Low testosterone, or hypogonadism, or low T it is commonly known, has certainly been receiving its share of attention lately, deserved or not. Actually, I think it does deserve some attention, but not necessarily for the reasons that it typically has been. So I know you've seen the statistics. Since 1993, prescriptions for testosterone products have increased 500%. Most people blame this on pharmaceutical advertising, media attention, but often overlooked is there's actually data that show the condition itself is on the rise. Over a 20-year period, hypogonadism is projected to be involved with approximately 1.3 million new cases of cardiovascular disease, 1.1 million new cases of type 2 diabetes, and over 600,000 osteoporosis-related fractures. We have an idea that low testosterone is bad. It's associated with several complications. However, there is really no consensus on when to treat. The Endocrine Society in their latest guidelines admit that the threshold testosterone level below which symptoms and adverse health outcomes occur, and that the administration of testosterone would improve those outcomes, is not known. They recommend using levels of 300 nanograms per deciliter, but only because patients have a higher probability of being symptomatic below that level than above it. So certainly testosterone therapy can improve the typical signs and symptoms of having hypogonadism, but there's also studies that show benefit in other areas, including cardiovascular risk factors, cardiovascular events, and mortality. So in spite of all of this evidence to the contrary and the significant amount of publicity that talks about cardiovascular risk with testosterone replacement, there have been a large number of studies that have not shown these risks. So in conclusion, I guess I would say that the data showing cardiovascular risks with testosterone treatment is weak at best, especially in light of the large number of studies to the contrary. Certainly some more randomized placebo-controlled trials with larger numbers of patients and longer duration are needed. There is one undergoing right now. The National Institutes of Health funded testosterone trial should have data available fairly soon that will hopefully help clarify some of these cardiovascular risks. And then I also think that some of these high-risk groups need to be further studied. Some of those diabetes trials were very interesting in the reductions in mortality and A1C in those guys. And then even some of the cardiovascular studies that showed reduction of mortality with treatment needs to be looked into. And then also, hopefully, further study will help clarify a threshold level that we can all agree on for testosterone levels in treatment.